Now we're going to talk about different ways to monitor the baby's heart tones throughout labor. So your care provider will want to monitor your baby's heart tones while you're moving through the labor process, and there are many different ways that they can do it. The options will vary depending on which location you're birthing in. Home birth and birth center midwives tend to use intermittent oscillation with Dopplers or a fetoscope. Hospitals tend to recommend external fetal monitoring and in some cases internal fetal monitoring. So intermittent monitoring should always be available per your request. Let's start by talking about external fetal monitoring. External fetal monitoring is a way to monitor the baby throughout labor continuously. This intervention uses ultrasound technology to monitor the baby's heart rate as well as a pressure sensor to monitor uterine contractions. There are 2 different devices that are placed in different parts of the belly and strapped onto the belly. When someone has Pitocin in their system or an epidural, it may be wise to monitor continuously throughout labor because in those cases, the risk of fetal distress goes up. So being able to identify fetal distress quickly may be optimal. But in an unmedicated birth, the research that we have shows that external fetal monitoring and continuous fetal monitoring in general actually increases the use of cesarean, forceps, vacuum, and other interventions without improving outcomes. So what are the benefits? External fetal monitors lower the rate of newborn seizures by 0.15%. They also identify the presence of fetal distress quickly. What are the risks? Increases the use of other interventions such as cesarean sections, forceps, and vacuum deliveries. Monitors may be uncomfortable and they may restrict movement. Healthcare providers may pay more attention to the monitor than the person in labor. External fetal monitors can sometimes cause itchiness or uncomfortable feelings on the skin. And if the monitor is continuously falling off the belly or not staying in the right place, it just might feel like a hassle trying to keep it in the right place while you're also trying to cope with labor. Some hospitals offer wireless monitors, so the monitor is strapped to the belly, but they are not connected from wires to a machine, which means that there is more freedom of movement. However, some hospitals will say that they have wireless and people will show up for labor and they'll say, oh, all our wireless monitors are actually being used, in which case, if you are planning for wireless, now you're not able to access wireless. Also, someone in labor may not be able to labor in the water with certain kinds of monitors. Now let's talk about internal fetal monitoring. This is another form of continuous monitoring. So this intervention monitors continuously throughout labor, but it does come with more risks. With this intervention, there is something to monitor the baby's heart tones throughout labor and something to monitor the uterine contractions. The care provider will administer a very tiny spiral wire into the baby's scalp. To monitor the birthing person's contractions, the care provider will administer an intrauterine pressure catheter. This is a tube that is inserted into the uterus to identify both the strength and the duration of a contraction. One thing to be aware of is that the FSE or fetal scalp electrode and the IUPC or intrauterine pressure catheter are both recommended more frequently to larger bodied people. This is because there is a stereotype that larger bodied people are more difficult to monitor. They recommend a path that is just more convenient for the care providers and the care team in their mind, which would be internal monitoring, even though that might not be the best choice for that person in labor. In truth, we do not have any research to support that larger bodied people need internal monitoring. So let's talk about the benefits. FSE offers an opportunity to identify the fetal heart tones internally if for some reason identifying them externally is not working. FSE is considered to be a safe option for monitoring in labor. IUPC monitors identify the strength of contractions, while external monitors only identify the frequency and longevity of a contraction. Some care providers believe that internal monitors allow for more freedom of movement, while external fetal monitors restrict movement more, depending on if the external fetal monitor is wireless or it's not wireless. There are still going to be some barriers to movement, including the fact that you have tubes coming out of your vagina. Another risk is that observational studies have found higher rates of infection with internal monitors. There is a risk of fever ranging from 12% to 36%. There is a potential that the baby will have a small cut, mark, or abscess on their head from the monitor. There is no research to prove that internal monitoring improves outcomes for newborns. The procedure requires a ROM if the amniotic sac is not already ruptured. There are case reports illustrating damage to the placenta, the vessels in the cord, infection, and shock. Now let's talk about intermittent oscillation. Intermittent oscillation is a form of monitoring heart tones throughout labor intermittently rather than continuously. This form of monitoring is often seen in the midwifery model of care, but any person has the right to advocate for this kind of monitoring in any setting. To monitor this way, the care provider will hold a Doppler or fetoscope to the belly of the person in labor and listen for the heart tones until they're able to identify the number. This usually takes about 10 seconds. The care provider can reach and access the belly in many different positions that the birthing person is in. This means that the person birthing can be in the water, they can be squatting, standing, lying in bed, and they often don't have to change position very much in order for the care provider to access the heart tones. Another option some people consider is intermittent external fetal monitoring. This means that the person in labor is monitored with the external fetal monitor, which are those two straps that wrap around the belly, every 20 to 30 minutes each hour. So instead of being continuously monitored throughout labor, and instead of being intermittently monitored throughout labor, it's kind of like a compromise, meet in the middle type situation. Unfortunately, this form of monitoring is not well researched. You have the right to choose the path that feels best for you.